Okay, class, now that we understand about positive and negative feedback loops, let's talk a little bit about thyroid and parathyroid function. So, one of the main important uh, functions of calcium is that we need calcium in our diet, but we also need regulation of the amount of calcium because calcium is needed for a few things, right? I mean, everyone, when we think of calcium, most people go, well, we need it for bones and we need it for teeth. Yes, of course, our bones are made up of calcium. But calcium is also needed to help our blood clot. It's needed for nerve signaling. It's needed for muscle contraction. It's needed to help release certain hormones. It's needed for normal heartbeat. Okay, so we need this regulation between the two, and this is where our thyroid and parathyroid come into play. If we have dysregulation of it, if we don't have thyroid and parathyroid, you can get these crazy spasms that can take place. So some people have it here, some people have it on their calves, some people have it in their toes. So this is just called a carpopedal spasm due to hypocalcemia, meaning decreased calcium in your blood can cause overexcitability of the neural system and create muscle spasms of the hand and feet. So we need we need something in check to help us regulate calcium balance. And of course, that term balance is homeostasis. Now, balance doesn't mean that if we have a seesaw, it's always even. That's not what we mean by homeostasis. It means, okay, if we have this going up and this going down, then we'll have something kick in that can bring this back up and bring this one down as we need to. So, calcium, we have one, two, we have three different pathways, three methods to help increase calcium or decrease calcium. And those three parts of the body are going to be the bone, your digestive tract, and your kidneys. So, your bone, you can either put calcium in your bone or you can take calcium out of your bone. You can take calcium from your digestive tract and bring it into blood, or you can go from blood back into your digestive tract. You can go from your kidneys and reabsorb calcium into the blood, or whatever calcium we have in the kidneys, we can excrete it out. So, in each, whether it be the bones, the kidneys, or your gastrointestinal tract, it's a two-way street. It can either be an on or an off switch. Now, calcitonin is secreted by the C cells. The C cells, right? C for calcitonin, of your thyroid gland. When the blood calcium concentrations get too high, we call it hypercalcemia. Whenever you see emia, it means blood. Calcium. Hyper means too much. So when there's too much calcium in your blood, your C cells of the thyroid gland release calcitonin. And it says, okay, let's try and use the bone, the intestines, and the kidneys to try and decrease the amount. Okay? Now, parathyroid does the opposite. Parathyroid hormone is secreted by the parathyroid gland. Now, if this is your thyroid gland, looks like a letter H, very simple. On the posterior part, you're going to have these four glands. You can't see it from looking at someone from the front, but these lobes wrap around, and on the posterior side, on the superior and inferior portions, you're going to have the parathyroid glands that secrete PTH. So it's released when the blood calcium levels are too low, then parathyroid hormone can increase the amount of calcium in the blood, again, by affecting these three parts of the body. So let's look at them. Here we have factors that can increase blood calcium levels. So something happened, we have low calcium in your blood, and we're trying to raise it. So the parathyroid gland releases parathyroid hormone. It's going to go to the bone, the intestines, and the kidney. Parathyroid hormone is going to stimulate the osteoclasts. The C in osteoclast, or see you later, it's involved in eroding and breaking down bone. So if you break down the bone, you're going to release the calcium from the bone, and it's going to go in the blood, and your calcium levels in your bloodstream go up. Parathyroid hormone is going to have an influence over your intestines. It's going to increase the absorption of calcium from your diet, and it can do that because your kidneys make vitamin D. That vitamin D allows us to absorb calcium from the intestines. The calcium will be absorbed into your bloodstream, again, increasing your blood calcium levels. The kidneys are involved because we know it makes vitamin D, but the kidneys can either activate or shut down, right? Your kidneys can either pee out calcium or it's going to shut it down so you conserve the calcium. So that's what's going to happen here. It's going to decrease calcium loss in the urine. All of these are preserving the amounts of calcium, all have a net result in increasing your blood calcium levels. Now, on the other hand, there could be factors that decrease blood calcium. For some particular reason, we have too much calcium in the blood. We have hypercalcemia. So the thyroid gland releases calcitonin. Calcitonin goes to the same three parts: bone, intestines, and kidneys. Now, since there's too much calcium in your blood, it's going to say, hey, let's deposit calcium in the bone. So let's inhibit the osteoclast. Let's shut down the cell that's breaking down bone, and let's stimulate the osteoblast that builds up bone. Okay, calcitonin. Well, the kidneys are going to produce less vitamin D so that we're absorbing less. If you're absorbing less calcium, that's going to decrease calcium levels in the blood. And if the kidneys are excreting it, you have three mechanisms in which you can decrease serum calcium. So calcitonin, its main function is to decrease calcium levels, whereas parathyroid hormone was designed to increase calcium levels in your blood. Right? And this is kind of like a summary of the two. So you got calcitonin here, and you got PTH here. So calcitonin is released by the thyroid gland. And what's it going to do? It's going to stimulate calcium deposition in the bone, right? Calcitonin, its main job is to decrease the amount of calcium in your blood. So if it's trying to decrease it in the blood, let's put it in the bone, right? Let's put it in the bone. And what are the kidneys going to do? They're going to pee it out. Now, if you're trying to increase it, this is where parathyroid hormone comes in, and it's going to go, all right, we're trying to increase calcium levels, so let's stimulate the osteoclast to break down the bone. Let's increase the uptake by the kidneys. We'll allow vitamin D production so the intestines can absorb more. All of that is going to increase vitamin D production. So you have this thyroid parathyroid gland connection where they're working in harmony, synergistically, but in antagonistic ways because the hormones do opposite things. That is homeostasis, right? Trying to keep calcium levels in balance. When we come back, we'll look at the adrenal glands.